I hope all of you know that you're here because we're asking you to become champions. Your opportunity here is to figure out what Lake Chelan wants to be when it grows up. And it's not going to be what you want it to be in this building. We are in the middle of an enormous shift in American healthcare. And you folks are right here at ground zero because you've got to make some important decisions about how you want to respond to that shift. For years, running a hospital was only about the building. Now we're trying to move into a world where we are oriented to a population that is sick a good bit of the time. The boomers are here, and most of us are managing a whole bunch of stuff that carries with it all sorts of health needs that don't necessarily demand an inpatient unit, but they sure do demand a healthcare team and good access to high-quality care that's designed to help us grow old in place, because that's what we want. And that's what you're trying to do. That's what this team is trying to do. That's what your commissioners are trying to do in this community, is figure out how we take that next step forward. Some of it is about a building, but it's about a lot more than that. My job is to try and help develop rural systems, to try and be right in the middle of the shift from moving away from being a real focus on acute care and into a larger focus on how do we design services and adapt the delivery, responding to people better where they are. About half of the critical access hospitals in Washington State have done what was announced here last week, merged with a local clinic to try and better organize primary care and to try and bring primary care and hospital care closer together. So you're part of a trend here that we see happening all across the state, and it ought to help things be better integrated. But that move towards trying to integrate primary care and hospital care and EMS better together is all about this shift from being about what's happening inside the building to being about what's happening out there. So we're trying to support that here with that work. Why are public hospital districts different? So you've got nonprofit healthcare systems. Confluence is a good example of a nonprofit healthcare system. You've got for-profit healthcare systems, and we don't have very many of those in Washington State. Overwhelmingly, in small towns in Washington State, care is organized around a public hospital district model. That happened in the 1960s, when we had a whole bunch of Catholic and Lutheran and Adventist institutions in our state, and the people running those hospitals couldn't figure out how to keep them going. This was before we had Medicare, and figuring out how we were going to get old people health care was tough. Those places ran out of gas. This is the first job I did for the State Hospital Association. In every community, the conversation was the same. We've got to keep the hospital open. The mantra here has been the same for the whole time I've worked here. If you want to attract good physicians, you've got to have a hospital. You've got to have a healthcare system that they can rely on. If you can't attract good physicians, you're going to have a hard time attracting teachers and other young people to your town. And if you can't attract teachers and young people to your town, you're going to have a hard time keeping your community going. So that circle that includes the schools, the hospitals, and the churches has been one that has been around in rural Washington for a long time. When people think about when I want to move to that town, what they're thinking about are churches, schools, in healthcare.